Hello everyone, I'm Dr.Sakshi Malhotra. I hope you all are doing great. So today I'll be discussing about important alarming signs in first trimester. So bringing back the basics. First 3 months of your pregnancy are very important and are very crucial. Why? Because most of the miscarriages, most of the abortions happen in the first 3 months of pregnancy. So that is why you must have heard your elders saying that फर्स्ट 3 मंथ्स में अभी इतनी जल्दी प्रेगनेंसी डिस्क्लोज मत करो, नज़र लग जाएगी. Whenever you miss your periods, I would always recommend that you go to your nearest gynecologist. Why? I'll explain you. So now, when you go to your doctor, she will do a urinary pregnancy test by which it will be confirmed whether you are pregnant or not. So now what's the catch? When we do a UPT, you all know that two lines are confirmatory that the test is positive, but if the lines are faintly positive, that may point towards ectopic pregnancy. So you should visit your gynecologist and accordingly she'll decide if serum beta hCG levels are to be done or not. Now, what are the alarming signs that you should not miss at all? If you have pain, if you have any sort of bleeding or spotting, then you should go to your nearest doctor. Why? Because some kind of pain may be due to some normal UTI, urinary tract infection, or some sort of vaginal discharge, but it can also be a manifestation of ongoing miscarriage or ectopic pregnancy. Most of the times, ectopic pregnancies go undiagnosed because these symptoms are ignored, and ectopic pregnancies are medical emergencies. Always pay attention if you have any kind of bleeding or spotting or pain. Another important point of consideration is that if you have some pre-existing disorders like hypertension, thyroid disorders, diabetes, or any other health issues, you should always go to your doctor because the medicines will be started accordingly. You all know that all sort of medicines are usually not prescribed in pregnancy because most of the medicines they can travel through the placenta into the baby. So you need to visit your doctor so that she can decide what medicines are good for you and what are not. Another point is morning sickness or some amount of nausea or vomiting is considered common in the first trimester. It is all because of the interplay of hormones which are ongoing to support your developing pregnancy. Now, what is not normal? If you have excessive nausea and vomiting, that your daily routine activities are disturbed, you are vomiting even after drinking a sip of water, even after eating anything, you are not able to tolerate orally, then you have to go to your nearest gynecologist because this can lead to dehydration. It can lead to ketoacidosis, and if this vicious cycle continues of dehydration and then again vomiting, which will again lead to dehydration, then it can cause electrolyte imbalance. It can cause hyponatremia, hypokalemia, which need to be cured. Lastly, if you have any sort of vaginal discharge, uneasiness, fever, or foul smelling discharge, you should visit your gynecologist because it can be a sign of undergoing infection like cervicitis or vaginitis. This infection has to be cured because infections can indeed lead to miscarriages. So, always be more concerned about your pregnancy because obviously it is precious, it is special to you, and stay connected. Thank you.